Okay, hi everyone. I want to welcome you to the 2 o'clock May 27th Board of Health meeting. And this meeting is being held virtually through Zoom. The town of Littleton began conducting remote participation Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19th, 2020. Since that time, unanticipated legal concerns relating to the open meeting law have been brought to our attention by the town clerk. Those concerns were supported by the Attorney General's office and confirmed by town council. One concern is that the chat function allows a parallel text conversation to a board's public meeting. Chat is essentially running commentary that is occurring, but it is not moderated or followed by the chair. All participants and listeners may not be aware of comments being made because of some meeting participants join by phone and do not see these conversations. Another concern is conversations between residents within the chat room, which are not incorporated into the public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the meeting are set to so their microphones are muted. If you called by phone, please use *6 to mute and unmute your phone, so that the meeting can occur in an orderly fashion. We ask that people who join keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you called in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, participants should unmute, then state their name and address. After speaking, we request the participants return their microphone back to mute. Okay, so here we are, whatever week number this is. Scott, would you like to bring us up to date first, please?
Sure. As we, I continue to get updates from Jim as far as new cases through town. I think as far as the last update on the state, the count was 94. I think that was like as of the 20th. That number goes up and down. And, as some people come off the list and some additional go on. But it's kind of nice to see, as the entire state, the numbers continue to drop. So that's a good thing. I would say for the most part, people are still wearing masks out in public. Depends on the day. I think some people are starting to get a little lax on that as, the governor has started to release a little bit of things, but I think that's, going to be up to different facilities to kind of police that. We haven't really, everybody here, I should say, is healthy. So we're still doing some limited COVID responses, nothing like we were originally. We still continue to use all of our PPE, and people in general in town are still very, respective of that. And our appearance and whatnot as we, show up for the different issues. I don't think there's really, I know there's a few little things that we have to address coming up in the town, or between you guys and the Board of Selectmen, between summer camps and the beach and stuff like that. But other than that, everything is pretty status quo. Actually, the one thing that I did want to touch on, Alex McCurdy, has been, for part of the volunteer corps. They have been developing or an update, I should say, to the EDS. Going forward, if we determine that's going to be needed for, at some point for vaccination, hopefully that should be ready. They have the initial portion of it appears to be complete. They are looking at doing an active drill probably at some point in August. So right around that time, once the active drill has been completed, they would technically they would be ready to assist, say that Neshoba Board of Health in setting up an EDS. But they're making really good progress with the updates on that.
I was just thinking, Scott, as it winds down and you get fewer cases, and maybe there comes a time where you're not getting any calls for a little time span, and then it's going to stop back up again. When you get a call, is it part of your regimen that you ask, do you think it's COVID-19, so that you guys are prepared when you go into a house or the nursing home or wherever? I'm just worried about if we get a spike or something, that you're going to be protected.
Yep. So it starts right at the 911 center, right with dispatch. As soon as the call comes in, dispatch asks a series of questions. If it's potentially COVID related, if there was any travel. We're kind of out of the travel range right now, but if they've experienced any symptoms, they relay that information to us. We will still be taking precautions for the foreseeable future of masks, gloves, everything like that. If it is positive COVID symptoms, chest pain, respiratory, things of that nature, we'll take additional precautions and make sure that everyone's, whoever's working with the patient directly will be wearing like a Tyvek suit or something of that nature. And what they try to do is they try to have the patient meet us outside, so that we really try to limit the exposure of being inside someone's home. Obviously depending on their condition and if they're able to ambulate us. We'll continue that for the foreseeable future. And, there's no intention of changing the way we're operating for that, just, for everybody's safety.
Okay, that's great. Does anybody have a question for Scott? Okay.
Quick question. Sorry.
Oh, go ahead, Kim.
So I've just been reading a lot about, what the future may hold, and in regards to, the COVID-19 pandemic. Some folks are alluding to, like, there's a bigger, badder one down the pipe coming our way, and maybe we should just make a list of things that we can sort of be prepared for, when this all dies down, and use that time and opportunity to, stockpile or make a plan, or just get everything in line and what we need, so we're not sort of behind the 8 ball, next time it comes around.
It's already in progress. We're already starting to, build up our supplies, replenish what we had, and we'll definitely be in a bit of a better position. Nice. as we go forward to deal with anything that comes forward.
Yeah, let us know how we can help. I feel like, there's grant money out there and ways that we can try and source things. And
already working on it.
Awesome.
Yep. Thank you.
Thank you.
Scott, have you seen an uptick in anything because of the phase 1 changes that started, Monday?
No, not really. There's definitely more traffic on the road, and there's more people out. But I would imagine, keep an eye on roughly the next 14 days. Yeah. Next 14 to 20 days, and see if there's an increase in any numbers. Depending on everyone's activity out there. And hopefully people are still using some level of common sense and, taking some precautions. We can only hope for that.
And I also wanted to commend you guys and the police on all the birthday parades that you guys have been doing. It's awesome. It's
Thank
just such a nice small town thing. You guys can take that time out of your day and do that for everybody, for the little kids. So
Yep.
thank you.
That was a good little entertainment thing that, yeah, for the kids.
Yeah.
How, is that once a week? How often is that?
They've been doing it every day, and
Yeah.
with the unfortunately of some of the changes with things getting active again in town between us and the police. I believe this Sunday will be the last day for that.
Oh. I'm a little kid, Scott. It's going to be in my birthday too.
Gino, you're special.
Save the date.
Everybody knows my date, but I'm not going to tell you. Only Scott will find out.
Let us know, Scott.
Good job, Scott.
Okay, Jim Gareffi, would you please update us on what's new?
So what's new? I don't know. Things seem to be changing all the time. I sent Louise an email this morning, some updates on what is opening and how they go about opening, some interpretations about how people can open certain facilities. I haven't had a chance to read it yet because I've been on the phone all morning, well, almost all day. So one of the things we are doing, we are getting calls from people who are asking how they can reopen. And so we're going through the checklists that are up on the state's website. There are, as I mentioned to you, either the last meeting or the meeting before, these sector-specific workplace safety standards that places need to follow. They need to go through that. It's not something that we need to check ahead of time. We have to do pre-opening inspections. It is a self-certifying process. But as I'm explaining to people, if we get complaints, then we're going to be coming in looking for that information. We're going to be looking for your checklists. We're going to be looking for your compliance checklists. And the conversation essentially goes, you need to be doing the things you need to do in a public health sense to make sure that everybody's safe. And that's really the important part of this. You can have that whole long checklist, but the real important things are the social distancing, the face covering, and following the other guidelines that are in there. I said that's going to lead hopefully to a successful opening of the economy. So those are the conversations we're having with people at this point in time. As far as the counts go, we do still receive cases. When we get cases, our public health nurses are reaching out. If we get clusters of cases, well, the nurse will work with the facility to actually work. We essentially, like a long-term care facility or a group home, we'll work with those individuals on site, the healthcare staff on site, to make sure the isolation and quarantine protocols are being maintained. I don't know if anyone else has any questions. I know we have the upcoming meeting Friday about the beach to discuss the plans down at the beach. I don't know, Scott, if you've heard anything about what's happening down the beach. I haven't had a chance to get down there other than Tuesday to pull the beach samples. So
I was down there yesterday. There were a few people on the beach, but everybody was respecting their space. Didn't look like anything, really out of the ordinary. And they had, all the parking spaces barreled off and every other space, stuff like that. But it looked pretty tame.
good. That's good to hear. I think that's all I have at this point.
I have not had a chance to read your email yet, Jim. So I don't know if Janet forwarded it to everybody or I will forward it to the rest of the board when we get off of here. Does anybody have a question for Jim?
You're doing a good job, Jim.
Thanks, Dino.
You said you have sector-specific self-certification. Where do people find that, Jim?
So if you go to the mass.gov site and click on, even just click on mass.gov, it'll bring you the link for the Corona page. On that Corona page, all the way over to the right there's 3 tiles that contain all the information. One of them says Reopening Massachusetts. If you click on that, it brings you to all of that information, the general information for business, and then all the sector-specific information. And it goes through, there are checklists there. You're supposed to do a compliance template so that you kind of self-certify that. So that self-certification template's there. And it essentially is asking you to go through the workplace, the sector-specific workplace safety standards to make sure you understand and are compliant with those things.
Okay. Question specifically about private clubs and VFW, Elks kind of thing. Are those in this phase yet?
I would say at this point here, if they're doing assemblages of more than 10 people, they are not.
Okay. If they're under 10?
I guess if again, it's one of those things we can't really babysit. If somebody needs to go in and maintain the building, I don't think there's any problem with that.
Mm-hmm.
I think short of that, they're really not meant to be open at this point.
Okay. Okay.
I have a question. I didn't read the notices that closely. Just want to check in regard to medical and health services. What is the current status of dentistry? I mean, I realize it divides itself into pieces, but
Want me to answer that?
sure.
Jim, go ahead.
Well, I was gonna say, last I knew it was still emergency. I'm not sure if they're opening for anything more than that at this point here.
It's emergent care, pending cases, things that are in process, some periodontal treatment, people that are coming in more frequently that are considered emergent that might have periodontal problems if they don't get their teeth cleaned now, but still just emergency and backlog stuff. So I don't start until the 8th, and then again we have to no more than 10 people, and we're on the full PPE, and I'll be working 2 half shifts a week until we can have more than 10 people in the office. So be a while.
Sounds about right.
Yeah. I mean, some offices are not doing that, but the guys I work for are very conscientious and they care about the staff and their patients. I see on Facebook all over the country, people are working 8-hour shifts, and they're, different states have different recommendations and different requirements. So I'm kind of lucky. So.
Well, the reason I focused on it, and the other place would be, I'm not sure what category it's in. The other one is audiology. I'm thinking of certain age groups that use these services slightly more than the bulk of the public.
Well, dentistry, it's the aerosols that they're worried about. I'm not sure about audiology, except for the 6-foot social distancing. That's an issue.
Yeah, that's what I was asking
Getting
Jim.
your hair cut, or getting your nails done, or getting your teeth cleaned, or fillings done. So.
Yeah.
So again, I would imagine I can actually look, Mike. I haven't, like I said, that today's email came with a new chart about what's open and what's not and the guidelines. So again, because the audiologist you're probably sitting in front of talking, again, they've got to have some workplace standards, and they're probably
right.
still.
And then the masks and being the people can't, if they're depending on reading lips, or the people, the clients, they might that might be hard for them to do too. Yeah. Everybody wearing masks. If you can't socially distance.
Yeah, I can see the client wearing masks be difficult, but I'm hoping the staff is also considering using what we call, I guess it's the face shield, the plastic bubble that apparently works pretty well.
If you're not creating aerosols, I think that might be fine, but that's not my business.
Okay, I got a email from Alicia Day this morning. Actually, it might have been yesterday, about Friday's meeting, and she only wants one member there, and we talked about this a little bit yesterday, but she only wants one Board of Health member there so that we don't have a quorum. So, Kevin, would you mind going to that meeting on Friday 3:30, 3 o'clock?
Yeah, no problem. Just send me the Zoom.
Okay. And Jim, you would go?
I plan to be there. Yep.
Okay, that'd be great. Just those two. Okay. Any other topics?
Just to be clear, there'll be no vote then on a permit. Is that correct?
I believe that a permit talk is for Monday, June 1st meeting.
I just want to get that straight. Okay.
That's how I understand it. So it will be the Board of Selectmen, Park and Rec, and I think FinCom will be there. And not sure. I think that's it.
When, on Friday or the 1st?
The first.
Both, actually.
Okay.
Okay. Seems like, I don't know, is there anything else?
I guess stay tuned to see how the reopening goes.
Mm.
We'll know about 3 or 4 weeks from now how it went, maybe.
Actually, you know what? I do have a question, Jim. Tim from Park and Rec mentioned something in the last meeting that we had, that the phases are actually going to be 6 weeks for data, to accumulate data and then to evaluate it.
I have not heard that, so
Okay, I hadn't
can't really
either.
comment on that.
Okay. And I didn't think that it would take that long to evaluate whether or not the cases had gone up, unless you're counting, time to become positive, that kind of, 14 days to be tested.
That's what I thought that's what he meant by adding the 2 more weeks for each phase, was to see
Yeah, maybe.
cases
But
develop.
I heard no less than 3 weeks for each phase.
And that's my understanding. The 3 weeks gives you a week we're open, and then a couple of weeks to see if stuff develops before the.
The third
But-
week.
That's how I understand the state was doing it, but so I haven't heard the 6 weeks.
Okay, all right. All right, thank you.
Okay. So Kevin and Jim Garecki will attend the meeting on Friday with Park and Rec. And I think that's all. Does someone want to make a motion to adjourn?
Make a motion to adjourn.
I'll second.
Okay, let's do a roll call. Gino?
Gino say yes.
Lisa?
To Flanagan, yes.
Mike?
Mike Selden, yes?
Kevin?
Sorry, I thought I was unmuted. Kevin Baker, yes.
And Louise Nichols, yes. Thanks, everybody.